Let's be honest. We have all looked up our health problems on the internet before consulting a doctor at least once in our lives. And we have had the internet tell us that it could be a symptom for a type of cancer. And no matter how rational we are, we have been scared by the thought that a persistent fatigue or a tiny mole on our face could mean something much bigger. Hi there, you're listening to Unviral, the podcast where we tackle that dangerous combination of the two kinds of virality: misinformation about health. I'm Parvati Mohan, production lead at Factly, and this episode is part 1 of 2 on myths about cancer. Let me begin with a disclaimer. This episode is meant to be an introduction to the myths around cancer. This is not an explainer on the various kinds of cancer, their detection, and treatments. Only certified medical professionals can help you with the right information on that front. There is something about cancer that strikes a deep fear in educated and uneducated people alike. This is probably because it is seen as an unbeatable disease that always leads to death. Perhaps it is because of such fear that many people avoid learning more about the disease. And this combination of fear and ignorance is a perfect breeding ground for misinformation. Social media and private group chats are full of colorful posts about what causes cancer and how to beat it. The first one, as I just mentioned, is the feeling that cancer is always fatal. Another myth is that sugar feeds cancer. Then there are people who believe that cancer is contagious, that every abnormal growth is cancer, or the misconception that it is predominantly a hereditary disease. In the rural areas, it is also believed that supernatural factors and ill fate influence cancer. And there are magic cures like coconut concoctions, cow urine, exotic fruits, and herbal medicines that have not been vetted by rigorous scientific research. What we need to keep in mind is that most of this is either utterly false or is only partially true, and so we need to be careful about accepting all this cancer-related information that is at our fingertips. We need to be wary of the changes in our bodies and consult an expert if we think that something is wrong, rather than doing an internet search and jumping to conclusions. We all know that there are several types of cancer, ranging from skin cancer to brain tumors. Yet, I wouldn't say that we really know anything concrete about cancer. Let us hear from Dr Vinay Deshmane, Medical Director of the Indian Cancer Society and a Senior Consultant Breast Surgeon and Surgical Oncologist, as he takes us through the basics of cancer.
What people must know is that cancer does not happen overnight. Cancer is basically an uncontrolled growth of cells, and it's literally a software problem in your cells. Each cell has a normal lifespan. It grows, multiplies, divides. When this function is done, it dies. In cancer, simply the cell doesn't die. So this is generally a very slow process because our body actually has methods when things go wrong. At the cellular level, they are corrected. It's when these mechanisms which protect us stop giving way and stop protecting us that the cells start multiplying and become cancerous. This process takes ages. It takes years for a cancer to develop in the body. So the first thing is that cancer does not necessarily mean imminent death. There are so many treatments that are available. You don't hear about the good thing that so many people are living such long lives after cancer diagnosis, very happily. You have patients who have climbed Mount Everest. You have a cancer survivor who swam the English Channel 5 times without stopping. I mean, these are sort of activities which need to be highlighted, that patients can actually live a very good life. But what's important to know is that there is nothing like a magic bullet.
The next thing a person would need to know would be the symptoms we should look out for before seeking the help of an oncologist or a cancer specialist. Dr. Deshmane takes us through some of the common symptoms to look out for.
The commonest symptom is that of a lump in the body which doesn't go away. You could also have ulcerations, that means small ulcers on the skin, changes in the skin, bleeding from the rectum or the backside, difficulty in swallowing, growths in the mouth, something on the tongue, discharge from the vagina. All of these are sort of signs that there's something going wrong. There are also some general signs, weight loss, general sense of not feeling well. It doesn't go away after 2 or 3 weeks. Any of these sort of symptoms which persist, a lump, a sore, an ulcer, bleeding somewhere, changes in the skin, and which don't disappear, need to be shown to a doctor. And I think that's the easiest way of identifying or diagnosing cancer. The doctor will evaluate you completely from head to toe and then advise what are the necessary tests to diagnose cancer.
Now that we have a slightly better understanding of the basics, let us find out what a person should do if they suspect that they may have cancer from Dr. Geeta Kadayaprath, a surgical oncologist with over 2 decades of experience specializing in breast cancer surgery.
Broadly speaking, when you're diagnosed with cancer, there are three elements to it. One of them, of course, the first bit is diagnosis. And once it has been diagnosed, then the next step to do is to understand whether it has traveled anywhere else or not, which entails some more investigations. And if once you've done that bit, the treatment bit is the third step. Lots of time what happens is once the diagnosis is made, you just jump to the third step, not knowing what is happening in the rest of the body, which is a wrong way of doing it. So you should be actually doing a staging. Staging is the second step, and then treatment. The pathology and the staging will determine what kind of treatment has to happen, what is the sequence in which it has to happen, what are the drugs that are likely to act in a particular situation, because every person is to be treated differently. And with the advances that have been made, there is a lot of scope for personalized medicine. So that is something that one should be very, very careful about. That is, you must do the complete workup before going ahead with treatment.
The 3 stages in cancer treatment are diagnosis, followed by pathology and staging, and then treatment. What this tells us is that each patient has a unique journey with the disease, and it is important for doctors to understand their individual trajectory to design a treatment plan. There is no one size fits all in cancer treatment. But unfortunately, not many people are aware of this fact. Misinformation about cancer in several local languages is far more accessible to common people than authentic information. And so, people tend to undermine the importance of the second stage, which is pathology and staging, and instead believe rumors that say that biopsy is a dangerous process. Dr. Geeta talks about this and other myths she has encountered in her patients.
So, patients, there's a lot of information out in the online, and patients usually come armed with some information. But as doctors, we have to put everything into perspective and tell them what is the right way to move ahead. So, the myths can start from the time of doing a biopsy or not doing a biopsy. Patients would say, oh, biopsy means, my disease is going to spread. So for breast cancer, biopsy is the start point. You have to have a diagnosis before you can decide on how to go about dealing with it. But there are other sites where you would not do a biopsy. So if there is some growth in the gallbladder, it looks like early disease, you would not stick in a needle there. Or if it is the ovary, you would not stick in a needle there. So there are cancers where you would not stick in a needle, but there are other cancers where the starting point is a needle, which also goes on to say that putting in the needle does not cause the disease to spread. So this is one very common misconception, for which reason lots of times patients just procrastinate and stay back and don't have a diagnosis, and so it leads to delayed treatment, and obviously the outcome also suffers in the bargain. So this is a very common myth that we often face. And then there is also this myth that, if I don't have a family history, then I would not get disease. But one should understand that family history contributes to only 5 to 10% of cancers. And possibly genetics also contributes to that much. About 10% of patients would have a genetic basis for their cancer. About 80 to 90% of them happen without a reason, so for which we say that these are sporadic cancers. So I think, the important thing is once you know that there is something wrong, you have to go visit your doctor and seek advice, which is where the balance is going to be. And that is where you're going to make your decision on how to go ahead with treating the disease.
Dr. Geeta mentioned patients being wary of biopsy and other surgical procedures due to the fear that sticking a needle in a person's body will aggravate the cancer. We asked Dr. Deshmane about this, and this is what he had to say.
Yeah, I think there has always been a fear that if you dabble or touch a cancer, then it spreads faster and results in an earlier death. So, needling of a tumor, handling of a tumor has been associated in the minds of people with spread of cancer. And I think every time when the commonest way of diagnosing a cancer today is something called a needle test, where you put in a small needle into the tumor, take out a few cells or a tiny piece of tissue, which is evaluated to diagnose cancer. And people think that the minute you touch the tumor with a needle, cells are dislodged, and this results in cancer spreading. But this is not true. These sort of tests are now around for over 30, 40 years, and there is no data at all which backs that cancer spreads if you handle it. It's true, it is well known that if you touch a tumor, cells are shed into circulation, but most of these cells, practically all these cells, are destroyed in the circulation, and they don't result in spread. But this is something which has persisted, and probably this comes from the 70s and 80s when cancer cure rates were pretty low. Treatments were not available, and people used to come with very large tumors. So when you operated on large tumors, the outcomes were not necessarily very good.
In the beginning of this episode, I mentioned a few magical cures that are thought to cure cancer, cow urine being one that features prominently. Dr. Deshmane shares his medical opinion on this.
I think there is no way today that we know that cow's urine cures any sort of cancer, and lots of these sort of myths do exist. But for a scientific paper, it has to be peer reviewed, and two, the methodology of the research has to be very robust. That means the methodology is important because the methods that you use to answer the question should be appropriate to answer that question. And if you're trying a new treatment, the new treatment has to be compared with either no treatment or with an established treatment to say it's better. So these comparisons have to be done. And as I said before, there is nothing like a magic bullet. Because if there is magic anywhere or there's a cure in cow's urine, all over the world they'll be drinking and having cow's urine. I mean, you can't hide such facts. Everyone all over the world is desperate for a cure. And if there is anything, it cannot be hidden. Everybody in the world will soon be aware, and people will be using it. Or people will be testing it to check what are the ingredients in the cow's urine which cures cancer.
When people believe that a magic remedy like cow urine or coconut oil is the best cure for cancer, it often means that they are making the choice to follow only that method and not seek formal medical treatment. Dr. Geeta tells us why this is dangerous and what the trustworthy sources are.
We would assume that adults who actually go and visit these sites and pick up this information should have the ability to cross check it with real information. So if you want real information, it has to come through the various journals and the articles that are published in relation to that particular treatment that is being referred to. And if you don't find that kind of information, just have a second opinion or a third opinion. I'm a big proponent of encouraging patients to take second or third opinions and be convinced on what you're doing, because this is a huge decision. One thing that one should know about cancer is that your first chance is your best chance, and you should not whittle it away by spending time, energy, and money on the so-called magical cures and not getting anywhere, and then finding yourself in a position where you will feel very disadvantaged and not able to get the kind of outcomes you could have had you got to the right place at the right time.
Cancer is unpredictable, and that which is unpredictable is often scary. This sometimes leads to people turning to alternative methods like herbal remedies to counter the disease, as they probably feel more comfortable using these as opposed to going for chemotherapy and surgery, which may be more intimidating. In our research, we found a story about a celebrity who opted for alternative treatments after a successful run with formal medical intervention. In 2016, Malayalam actor Jishnu Raghavan passed away after battling cancer for 2 years. He had been treated by Western medicine for throat and lung cancer, but ultimately lost the battle to a vicious relapse. He was offered a lot of advice about trying herbal remedies like the Lakshmi Taru plant and licorice, popularly called mulattu or muleti. He tried these, but these did not help him battle the disease, and his tumor ended up growing further. He left a note on social media for his followers, asking them to be cautious while going for such alternative treatments, and said that these cannot replace formal methods of treatment like surgery and chemotherapy. He passed away less than a year after posting this message. But this is not to say that people should give up hope when they or a loved one is diagnosed with cancer. To quote journalist and cancer survivor Chitra Subramaniam, science matters in cancer treatment, so does faith, and in that order. We'll expand on this idea a little more in the second part of this episode, where we will hear from Dr. Geeta and Dr. Deshmane on some of the different types of cancer and listen to their messages to everyone who worries about the disease. And we will also understand in more detail why early diagnosis is the key to beating cancer. We'll leave a few links to important resources in the description for you to read in more detail. But do bear in mind that no website can help you like a doctor can. So if in doubt, let a medical expert help you. Until next time, take care, stay safe, and remember to unviral. Unviral by Factly is researched by Nandita Kalidas, written, hosted and produced by Parvati Mohan, and edited and designed by Jyoti Jiru. Thank you for listening.